All about sporting injuries, the elbow. Here we see the normal anatomy of the elbow and the so-called carrying angle between the radius and the humerus. Arthroscopy of the elbow is possible and can be very useful. Bursa around the elbow, the most important one is the olecranon bursa. Here it's grossly inflamed, quite painful, size of a golf ball. Exclude gout, may need to excise this bursa. Another picture of olecranon bursitis. Dislocated elbow. It's an emergency, easy to reduce, can fall out again, need to carefully assess the ligaments. Dislocated elbow, young patient. Another dislocation of the elbow, usually posterolaterally. Lateral pivot shift of the elbow, sounds good but not very useful test. Range of motion of the elbow, basically from 130 degrees of flexion to 0 degrees of extension and about 70 to 80 degrees of rotation. Supracondylar fracture lower humerus, internally fixed. Supracondylar fracture of the humerus, dramatic injury, prone to compartment syndrome, closed reduction, but you have to hold it usually with K-wires. Golfer's elbow, medial aspect of the elbow, tender, provocative tests. Tender lateral aspect of the elbow, tennis elbow, most common tests, pain exacerbated by resisted extension and palpation of tenderness in the region. Elbow brace can be useful, difficult problem to treat, frustrating. Tests for lateral epicondylitis, tender over the area, pain on passive stretch, pain on resisted active stretch. Assessing elbow instability, these are usually tests best done by orthopedic surgeons specialised in this area. Lateral ligament avulsion of the medial ligament complex, difficult to treat. Little leaguer's elbow, common in the US, a partial complete avulsion, medial ligament complex of the elbow. Lateral ligament complex demonstrated. Provocative test for cubital tunnel syndrome, that's where the ulnar nerve is compressed at the level of the elbow, giving numbness in the ulnar nerve distribution of the hand. Loose bodies in the elbow may cause locking, may need to remove them. Can have arthritis, posterior aspect of the elbow, usually post-traumatic. AVN of the capitellum may separate, become a loose body, may also heal. Panner's disease, AVN of the lower end of the humerus and the radial side of the elbow, the capitellum. This will usually heal. Throwing injuries, prone, cause shoulder and elbow problems. Rupture lower end of the biceps tendon. Remember what I said in the previous series? Surgical repair. Using a bony anchor into the radial tuberosity, I get good results doing it this way. There it is. Looks like a tongue of a lizard. Put it back onto radial tuberosity. Avulsion triceps tendon, unusual. Thank you for your interest, and please look out for the other joints in the sporting injury series.